Thank you everyone for joining the Minnesota HIMSS webinar on the importance of empathetic care in healthcare services, presented by Ryan Armbruster. We will be recording this event and making this available to all of our Minnesota HIMSS members. If you would like to be a speaker or a sponsor for a future webinar event, please reach out to us via our webpage, mn.himsschapter.org. We will do a Q&A at the end of the event. If you have any questions that you would like answered, please type those in the question section of the GoToWebinar, and we'll read those at the end of the presentation. I am pleased to introduce our speaker today, Ryan. Ryan currently oversees the Executive Healthcare Education Program at the University of Minnesota, where he has also designated and taught healthcare innovation and service design courses for the past 14 years. His recent work includes various roles at UnitedHealth Group, where he architected and implemented numerous innovations and capabilities, including Optum Service Design Studio. Ryan is a recognized pioneer and leader of human-centered service design and innovation, and his award-winning designs have made a significant impact in the healthcare industry. Thank you, Ryan, for presenting today.
Hey, thank you for having me, and thanks everyone for joining the call on what looks to be a beautiful Minnesota Friday afternoon. I'm really excited to share with you today some perspectives related to the importance of empathy in healthcare services. I think some of them will certainly be hopefully a bit provocative, with the intention of raising awareness, getting your attention, and possibly helping us take some steps in the direction of restoring empathy in healthcare today. Hey, as mentioned before I get started, I oversee Executive Healthcare Administration at the University of Minnesota for the past couple of years. We're currently the #2 program in the United States for training healthcare leaders. If anybody wants further information about that, I'd love to talk with you about our program and learn more about your interests as well. For today's talk, I'm going to approach the topic from a few different perspectives. First, I'm going to share a little bit about evidence on healthcare being a little off track today, particularly in regards to thinking about and prioritizing empathy. Then I'll shift a little bit towards, well, why should we be on that track, and why it matters and why it's important. And then lastly, share a few potential action steps and resources to assist you with thinking about restoring empathy in healthcare. First, I want to begin with a reflection. Prior to being at the university, I spent 20 years in the healthcare industry, most of that time being spent at Mayo Clinic and then in various different businesses and units at UnitedHealth Group. So 20 years of spending a lot of thinking and time around not only healthcare, but also opportunities in healthcare related to innovation. That is, how are we going to make healthcare work better for the people that it serves and create better value? Okay, so over those 20 years as an observer of the healthcare industry, one thing that's always stood out to me as seeming a bit outside of the norm is the amount of time and attention that healthcare spends looking for answers from other industries. Now, don't get me wrong, I think looking to other industries for examples and ideas is something that can benefit all industries, and all industries do it to a certain perspective or a certain amount. But for some reason, I always feel that healthcare is doing it way more than any other industry. Let me give you some examples. So the first is, oftentimes I hear in healthcare references to NASA, particularly when I'm involved in safety-related forums or safety conversations. And NASA is used as a case study or an example of, well, we should aspire to be more like NASA because NASA's focus on safety, particularly after the tragic disasters that NASA experienced. So maybe there's an opportunity here to learn from NASA. And I've actually been to healthcare leadership forums where there are experts from NASA telling stories about the tragic experiences and about how they put in, plans and operational plans in place to become more safe and reduce errors. We hear the same thing about nuclear power, although I haven't been, well, actually I have been on a board. That board, healthcare hospital board, had someone who had prior experience working in the nuclear industry. And he was there because of the nuclear industry's, reputable, track record of avoiding disasters and being very safe organizations. So maybe there's something we can learn from nuclear power plants. Maybe there's something we can learn about the Toyota production system. And as you know, this is where the healthcare industry has voraciously adopted lean principles to improve performance and reduce inefficiencies in healthcare. In a similar manner, but very different, healthcare has also rapidly pursued adoption of Six Sigma techniques, again, borrowing it from manufacturing. In this case, Six Sigma was invented by Motorola in 1985. We've also heard references to other types of industries, not just the manufacturing. You may be familiar with the book that references how healthcare needs to borrow some operational ideas from the Cheesecake Factory, believe it or not. That was written by Atul Gawande, who I love. Atul Gawande writes some amazing pieces, and this was one of his original ones around the checklist manifesto, where he references the Cheesecake Factory as an organization where healthcare can learn a little bit more. I think there's some irony there in healthcare, obviously, referencing Cheesecake Factory as a source of inspiration. A few more. In all of these, I've observed healthcare organizations seeking and modeling best practices from. You may be familiar with this one, operating rooms, operating more like Formula One pit crews. And there is a lot to learn from a pit crew and how efficient they are, and what can hospital operating rooms learn from pit crews. I've heard references to the airline industry, and not just hearing references, but yes, there's also a book for hospital leaders on how they can learn from the airline industry in managing patient safety and quality of care. We've referenced banks for security purposes primarily. Banks protect a lot of very private and financial and important financial information. So what can healthcare learn to better protect health information? This is a reference to retail and consumerism, and how can healthcare be more retail centric and retail focused and consumer centric, and we're going to return to this one a little later. References to Ritz-Carlton and a high level of service. Similarly, reference to Disney World. And again, not only just references to Disney World, but yes, there is a book. If you haven't seen this one before, Disney ran your hospital, 9.5 things leaders would do differently if Disney was running our hospital. And last but not least, why can't our clinics work even more like veterinary clinics, where I receive a reminder to bring my pet in for a visit, but yet I've never received a reminder to bring my child in for a visit. So a lot of references to how healthcare clinics should actually be learning from veterinary clinics. And there's so much there, isn't there? Now that was a mouthful, right, of examples, and those don't even represent all of them, but it's an indicator of just how much healthcare is striving to learn from outside of its own industry, looking elsewhere for answers on how healthcare can do a better job. Okay, well, one of the questions I have had when seeing all of these examples and all this searching for answers is, well, if all industries are doing a fair amount of that, then where are all the references or questions from other industries, looking to healthcare? Right? Shouldn't they be looking to healthcare for some inspiration, some answers to some of the problems they're thinking? Because my assumption was, well, all industries can learn from each other. But yet in 20 years of working in healthcare and actually doing some things that have been fairly remarkable within the industry, I don't recall, organizations reaching out, attempting to learn from me or from the organizations, within which I was working, which, started to make me wonder. But then the next question, again, I ask you to think about this question is, if other industries were to look, to healthcare for something to emulate or something to learn, what would it be? Not necessarily what is it, but if healthcare were really leading all the other industries and doing something that may be of interest to them, what would that thing be? I spent some time thinking about that, and I think I came up with an answer. And this may be the same answer that you're thinking about as well. I think the answer to that is this. I think the answer to that question is caring. If any industry should know how to care about people, how to care about people in an empathetic, emotional, heartfelt way, it should be the healthcare industry. Because there's arguably no other industry where that type of caring would be more important, because we're talking about people's lives. We're talking about their health and well-being. We're talking about their vitality. We're talking about their ability to live their lives to meet their ultimate goals and dreams. And that's such an important and fragile thing. It always deserves a level of, true human caring. Okay, and that's something that almost every other industry, any industry who has customers can learn from. Not that they need to reach the level of that emotional, heartfelt caring that healthcare should aspire to be at, but they all benefit from at least showing some type of, thoughtfulness or customer service related to their customers. And so if healthcare is at the pinnacle of that, there's a whole range of things, little or lots, that other industries could observe from that. But here's the thing. Nobody's coming to healthcare to learn that, at least that I know of. And I don't think when other industries and other organizations think about how am I going to serve my customers better, let's go learn from hospitals, because they care about their patients more than anybody else, and they know how to demonstrate that, and it's part of everything that they do day in and day out organizationally. Okay, I'm not talking about the nurses who go out of their way to demonstrate that emotional caring every day. Of course that happens, not as much as it should, because it's very challenging for them to do that. But I'm talking about organizations who have systematized it. It's part of the way they work day in and day out. And those things don't seem to exist in healthcare today. Okay, so I want to turn now towards, okay, well, to do that, to deliver that, that's a form of value, right? That empathetic caring is creating value for patients, okay? And that value is, traditionally defined as, health outcomes plus safety plus patient experience over cost. And in that equation that's used countlessly in healthcare, I think the piece of that that's most overlooked or least understood is the experience piece, all right? So what does that experience piece mean? And I want to dive into that just a little bit deeper here to talk about, okay, well, here's what that experience piece should mean or could mean, okay? And I'm going to use a model that was created in 2015 by Bain & Company. It was called the elements of value, all right? And in that model, they identified the 30 ways that companies, not healthcare companies specifically, but any company, the 30 ways that they can create value for customers. And they actually modeled it on Maslow's hierarchy of needs, where at the base you have just some of the functional value propositions. And those functional value propositions are all the things that you probably think of, right? I can reduce your effort, I can save you time, I can help you save money, I can help you make money, I can organize things better for you, all functional things, okay? But one of the points I want to make here is that the middle center at the bottom, quality is the fundamental of the whole entire pyramid. If quality doesn't exist, then the rest of the value propositions fall down. Okay, so that's why it's at the center, it's at the bottom. That is a requirement. Okay, everything else builds on that. So you got the functional attributes, and then next you have emotional value propositions. This is reducing anxiety, making things sexy and attractive, provider grade accessibility. The badge value, we've seen that used a lot by companies where you get rewarded by a badge, right? You feel like you're part of something, you've achieved something, okay? So those are all ways that companies can deliver emotional value. Then you have life-changing value, right? We're getting towards the top here. So life-changing are things that motivate people. You feel like you belong or you're affiliated with something. They help provide hope and maybe even self-actualization, which is I'm realizing my best self through participation in this service or purchasing this product. And then at the top is self-transcendence. It's like I've reached my goal of becoming the best human that I can possibly be, and I'm returning that now to others. And that goes beyond self. That's at the top. Okay. So these are the 30 ways. And so if you look at the 30 ways, one of the things that they point out then is they profile companies and they profile industries. And every company, every organization in their services that they deliver to customers usually hit on numerous aspects of the value pyramid. And the higher they can get on the pyramid, usually the more value that's created, okay? Or the greater the relationship or connection they'll have with their customers. Now, I think some of the promise of healthcare value lies in these aspects of the value pyramid, okay? Quality down at the middle at the bottom. I think the promise of healthcare value is a service that helps inform people, right? It helps inform them about their conditions or health outcomes or how to be a healthier person. Then I think it jumps up to emotional, right? And we'd all probably we probably all agree that the stuff on the left side of the emotional are all healthcare related, clearly value propositions, wellness, therapeutic value, reducing anxiety associated with diagnosis of new conditions or the uncertainty of disease pathways. Then I think it moves up to motivation. This is pretty clear, right? Is changing health behaviors and adapting to new health circumstances requires a lot of motivation. It requires the provision of a lot of hope in many situations to get through a lot of potentially life-changing situations. And certainly self-actualization, feeling like you can do this and realizing your full self, whether it's overcoming diseases or just getting healthier, reaching my health goals. Now that's the promise of healthcare, but in the face of all of that, there's a lot of countercurrents in the industry today that are countercurrents. They're actually running opposite to our ability to deliver on that value. First is organizations thinking about the institution more than the individuals and the people that they serve, or even the people within their organizations. And in the last webinar I shared here with HIMSS Minnesota, I talked about the importance of human-centric design. And that is really giving organizations the tools to think about, to understand their customers and to focus more on meeting their needs than focusing first on meeting the organizational needs. And that can be, and that's a challenge today where organizations seem to be thinking more about themselves than the customers that they serve. Second, fee-for-service models is a countercurrent. Fee-for-service models focus on transactional, one-time, consumeristic type behavior. Third is, and probably relevant to this association, are IT models and IT platforms. Not because they're intentionally doing the wrong thing, but IT platforms get structured around the ways that we work today. And therefore, they act as reinforcers, right, of some of the models and the directions that we're doing today that might not be accommodating towards delivering on the value proposition that we aspire to in healthcare. The specialty versus primary model, as we all know, we're heavily based in specialty services here in the United States and not very resource rich in primary services. Primary services are more relational and longer term, ideally, than certainly specialty services are more episodic and transactional. So our heavy emphasis on specialty is something more focused on transactional relationships. Process standardization makes things very efficient but very standard, and then we lack adaptability and the ability to tailor services and experiences to emotional needs and other types of needs that our customers have. And then lastly, one that I'll hit on actually a little bit here is consumerism. And my point of view is that our really heavy emphasis on making healthcare more consumerist or more, more focused on treating people and patients as consumers is actually working in the opposite direction of the promise of creating this value in healthcare. Here's why. I'll go one step deeper here on this one. Consumerism focuses, or all of these things actually focus on the following things on the chart here. So if you can see the circles I'm making here, one, reducing costs. And I'm not saying reducing costs in healthcare is bad, right? That's clearly not the message here. We absolutely need to reduce costs in healthcare, okay? But this is recognizing that consumerism is a trend that actually helps us do that. It's focused on avoiding hassles. Consumerism helps reduce effort, it helps save time. It's simplifying things, making things easier for people. It's also providing greater access. Consumerism is about selling people things as quickly and as much as possible. And then it's also about rewarding me, giving me incentives to purchase and to buy more. Those are the things that the countercurrents are reinforcing, the yellow things, but the maroon things here are the ones that, if you agree with me, that empathy, caring, and the true value proposition of what healthcare and the healthcare industry should be about. And so it's not necessarily that they're working in opposition, they're just not aligned on the same value proposition. We're focused on the yellow things today. What about those maroon things? And if we don't focus on them, we're not optimizing our organizations, our industry, our services around them, and they won't be there. And I think that would be a frightening position for our industry to be in. I mentioned I was going to go a little bit deeper on consumerism. So consumerism reinforces episodic and transactional models, and it implies that our customers or patients know what they need and can easily determine that. And that's just not the case in most all healthcare circumstances. And it's not because we don't provide people with how much it costs. I'm not talking only about costs here. We're talking about they need to know the right, resolution, the right service for whatever condition that they don't even know that they have, right? I'm sick. I don't know exactly what I need, to help me get better. And I need to navigate a system in order to find out the answer to that question. Proactive health management by nature requires support that feels one step ahead of me. And consumerism is not necessarily about being one step ahead of people. It's about meeting their needs exactly at that time and that place. And so consumeristic is transactional in the moment, where a lot of good health management services happen over time and actually feel, one step ahead of what I need at the moment. And I think about maybe a good point of view is that to think about this is consumerism is like a fast food restaurant. You know, that is consumerism at its finest. And healthcare really needs to be potentially more like a financial advisor, not necessarily transactional and quick hit, but more relational and trustworthy and something that happens over time. Now, again, some services might be a fit for a fast food restaurant, but more of them are probably a fit for a financial advisor. And it seems like we're making good progress on the fast food restaurant and not as much time and attention giving on the types of services and experiences that would be more akin to a financial advisor. And because of that, I think we're going to continue to see the results that the system, you know, is designed to get today, which is burnout of physicians, nurses, and other frontline healthcare providers, the continued growth of chronic conditions, because episodic transactional services are not designed very well to address chronic conditions, which is by far the growing concern in healthcare, and also continue to increase costs. Although we talked about a focus, you know, of trying to reduce costs, what's really driving the cost is the line item above it, which is the burden of chronic conditions, one of the biggest drivers of healthcare. So if we can't address that, it's going to be very difficult to get our handle around costs in the future. So I want to shift gears a little bit now. That's the situation to, again, another hypothetical question here, or rhetoric question. What if you could create a healthcare company, whether it's a hospital or a clinic or some other, you know, service, where the core differentiator was empathetic listening? What if we listened and offered ability to listen and to learn and to hear from our patients, to connect with them on that at a deeper level than any other organization? What impact would that have? Well, my hypothesis on that, you know, in terms of, well, why would you do that? What would you expect to get out of doing that? And here's what I'd say. Here's how I'd answer that. That if we care about people in the truly most empathetic, heartfelt, emotional way, that is the foundation of a really good relationship, right? Most oftentimes. It's pretty hard to have a really rich relationship with anybody or anything that you don't feel some degree of caring for or from. And that extends to our personal life, but it also extends a little bit into our, you know, professional and consumeristic lives as well. We're going to trust and rely on services that, you know, we feel actually have our best interests in mind, and in that way they care about us. So caring can establish a really rich foundational relationship. And it's not until you have a relationship like that that you really begin to truly trust in that person or in that organization. That relationship has to happen over time. That's how trust is built, you know, where you have repeated experiences where you sense that they're working and operating in your best interest. And trust today is really important. I hear healthcare organizations talking about, in relationship case, I hear insurance companies like UnitedHealth Group say, we need a better relationship with our customers. We want to have we want our customers to engage with us, or any healthcare organizations, does that further matter? We need our patients to engage. What they're saying is we want a relationship, but that relationship is going to result in trust. And trust is important because healthcare organizations want their customers, their patients, to trust them, because they want them to act and feel confident acting on the recommendations and the advice, and also trust them that they're going to be there for them when they're not able to overcome their obstacles to reach their health goals. Because if you trust them and that works and you feel like people are there for you, that's our path to improving health. The health conditions and the things we're dealing with right now in the United States are things that require health behavior change. They're chronic, they're lifestyle type things. We fixed most everything that, you know, you can fix with a surgery or you can fix with a pill. Not everything, but we got a lot of pills for a lot of things and a lot of surgeries for a lot of things. And what we're left over with is all the things that you can't treat with a surgery or a pill. The things that require the lifestyle, the behavioral change, you know, all those types of things that, or even to manage, you know, chronic conditions that aren't going to be solved with the surgeries or the pills. To do that, to manage those conditions, to help people get better, you have to be there for them, and they have to trust that you're going to be there for them. And that goes all the way back to care about them. When those health conditions improve, when they reach those health goals, when they change those lifestyles and those healthy behaviors, not only are they improving their health, we're reducing costs overall in our healthcare system. I had the opportunity a few years ago to actually test that hypothesis by building a brand new organization for UnitedHealth Group. The name of that company is called Harken Health. We built it from the ground up to test that hypothesis. If we built an organization from the ground up focused on empathetic, caring, and listening, could we achieve those outcomes? Okay, so what it was a combination of primary care, the best primary care that you can imagine, with an insurance vehicle that actually enabled that primary care to deliver on the promise and everything that it had to deliver. We built physical clinics in 2 cities in 2016, in Chicago and Atlanta. Here's a picture of one of the Atlanta locations, another Atlanta location. Take you inside the Harken Health centers. You can see warm, comforting, inviting environment, you know, where people, you know, greeted you by name and were immediately the types of people that you felt cared about you and were really vested in helping you, providing service to you, and helping you meet your health goals. The lobby of one of our Atlanta centers and exam rooms were warm, inviting, comfortable environments that clearly communicated, we care about you. The fundamentals of it I mentioned, you know, is a physical space, a primary care center. When you purchased a membership at Harken Health, which was actually your insurance plan, and this was for individuals who bought their own health insurance, they made a choice to buy Harken Health insurance. It provided them with unlimited, no charge access to primary care services at our Harken Health centers, where you had a care team that was dedicated to you. You could receive that care in person or on the phone or online. You could even text your doctors. You could email your doctors. It was basically whatever you needed, whenever you needed it. Yeah, I mean, that was the structure of the model that we built. Now, those are the fundamentals, but what I want to do now is play for you a really 2-minute video, and I hope that it works. We tested it out here previously, so hopefully the audio comes through fine. The best thing I can do for you is share a patient perspective on their experience with Harken Health. So here it goes.
The whole way that Harken is kind of doing their approach to medical care has inspired me to try and do my life a little more like that. One of the best things that's happened is Rachel, the health coach, will schedule times, you know, like we try at least once a week to take a walk. And she motivates me. She gets me, it gives me a reason for getting out of the house, getting moving. And so I've lost about 20 pounds since I've started. I'm feeling better about myself. They've helped me grow from where I was to where I am now. You feel like you matter, that you're cared about, and it's not just a single complaint of, okay, you sprained your ankle, and that's all they're interested in. That they seem to be interested more in the whole life experience. That's part of what Harken Health has instilled in me, is the feeling that confidence and that it's okay. We're accepting you as you are, and then we'll build upon that.
Building and launching the experiment for United Healthcare called Harken Health proved to me that empathetic caring in healthcare services can have remarkable and extraordinary impact on people's lives. In addition, it also pointed out to me what we're missing in the healthcare industry, because that type of service, for the most part, doesn't exist in healthcare today. And again, it's not because we don't have caring frontline professionals like doctors and nurses who come to work every day intending to deliver that experience. Not at all. They're actually the victims of a system, a structure, or a process that hasn't been paying attention to that, and has actually maybe unknowingly built all structures and processes to actually mitigate and kind of eliminate our ability as an industry to deliver that type of experience day in, day out, and enable our frontline professionals to flourish in doing something that probably got them into the industry to begin with, which is I want to take care of people and I want to care about people. And you see that in the burnout statistics. So here, that, I mean, you can read the quotes on the screen in terms of what people said about this experience. And it was, and again, because of, you know, these quotes point out the fact that it was a completely new and different type of experience, saying that, you know, in their time, they hadn't really experienced anything. The only people who said they experienced anything like it was our older generation of patients who recall a time back maybe 30 years ago where they had a family physician maybe in their small community that took care of everybody and knew everybody's name and knew everybody's family and participated in the community and had that type of relationship. And that was the last time anybody really had an experience or a relationship like that. So I wanted to wrap up my presentation, and hopefully we'll have some time for some questions or comments as well, with a call for better design, a call for a refocus on what should be the core focus of our healthcare industry. And the first organization I want to point to, you may have heard of them before, is an organization called Iora Health. They started about 6 or 7 years ago, and this was actually the organization we partnered with on our Harken Health experiment. Their care model was at the core of the Harken Health organization. And from the beginning of Iora Health, their focus has been on restoring humanity to healthcare. They have designed the company from the ground up to optimize and deliver that empathetic, caring experience for every patient that they serve. Not only made decisions about the design of the services, but every single supporting aspect of that organization, the IT platform, the physical spaces, the content, the other technological interfaces, everything optimized to deliver on that type of caring. So that's an organization, if you're interested in learning more about who's doing this effectively today or what models are out there, that is definitely one to spend some time becoming familiar with. The other thing I want to point you to is a former colleague of mine at Mayo Clinic, Dr. Victor Montori, who recently began an organization called the Patient Revolution, and he has a book called Why We Revolt. But his entire focus is around restoring clinical care that is focused on being careful and being kind. He has some great stories in his book about what it means to do that, as well as pointing to some of the ways in which we've forgotten the importance of that in the healthcare industry today. And by focusing on that careful and kind care is our way to restore health, to get our population to a better state of overall population health, and restore what I think is an absent service today in terms of what people need in their lives. not only is it the right thing to do, it also has physiological impact as well. Here's a number of studies that demonstrate the physiological impact of having a doctor that patients feel is empathetic. It actually has a physiological impact on an outcome, and these are all published scientific studies that show that having an empathetic doctor, or at least patients who feel they have an empathetic doctor, get better from colds faster, have improved cancer patient reported outcomes of depression and quality of life, have lower rates of acute metabolic complications for diabetes, have better control of their hemoglobin A1C for diabetes, have better recovery rates from depression. And these are just a few of the proven physiological results of people feeling like they have a doctor or a care provider that empathetically cares about them. If you didn't even need more evidence, check this one out. This is a map of malpractice rates per 100,000 residents in each of these states. And you can see the states where it's not so great to be a clinical professional based on the number of malpractice suits being filed in those states. What I will point out, and what this study also showed, is that there is a direct correlation between malpractice rates and guess what? How confident patients feel that their clinical professional cares about them. And so it's also a way to reduce poor outcomes and potential lawsuits and the like in the healthcare industry. I'll also note as a case example, having worked at Mayo Clinic for many years, that Mayo Clinic is, and they don't talk about this a lot, but they have one of the lowest malpractice rates of any organization in the country, and may in fact have the lowest rate of malpractice rates in the entire country. And although they don't credit that to anything specific, I'll tell you, after being there for 6 or 7 days, there's very few organizations that deliver on that message of, we're here to care about you and we care about you. Most every patient who visits Mayo Clinic has a experience with a doctor or nurse or other professional there where they feel like those doctors and nurses are doing everything they possibly can and in their best interest to help them. And when you feel like that, even if you have a poor outcome, you feel like they did the best that they can, and they were authentically trying to help you. I want to wrap up with a reference to one of I highly recommend this article. It's a really short article. It was in Harvard Business Review, June of 2015. It was called "Innovation Starts with the Heart, Not the Head." And it was one of the best innovation articles about healthcare that I've read. It profiles a small hospital in Michigan and on their endeavor to innovate and do what they thought was the best way to create value in healthcare. And I'll just leave you here with a quote from that article, and hopefully have the opportunity to check it out soon. So that's what I have for my talk today. Thank you so much for taking some time out of your busy days to join me. I'd love to have a discussion or get your feedback, any questions you have, or just general comments about the material today. I'd love to engage with them. So I'll open it up for any types of questions or comments now.
Perfect. Thank you, Ryan. If you have a question or a comment that you would like to share with Ryan, please type that into the question section of the GoToWebinar to start out with. So just as we're collecting some thoughts and questions here, Ryan, when you worked with Harken Health, what did you find, what were one or two top strategies or design elements that you thought were most successful in working with that organization?
Gosh, yeah, there are so many. And thanks for the question. And by the way, if I can't seem to catalyze some questions or discussion from the other participants here today, I'll feel very disappointed, because I was hoping to be a bit provocative. So if I didn't provoke folks to have a comment or a question, I'll be disappointed. But thank you for your question. There were so many things. I think at Harken Health, some of the design elements I thought were most powerful. One was, and again, the rare opportunity of building a company from the ground up means that you get to make every hiring decision, which, a lot of existing companies obviously don't have the chance to do. But that's a pretty remarkable opportunity. And our decision to place a very, very heavy emphasis on profiling, screening, and hiring people who are actually truly empathetic. And demonstrated skills in empathy, but just from a personality perspective, we're empathetic people. You know the types of people I'm talking about. They're the types of people you meet for the first time, and within 5 minutes, you feel like you want to give that person a hug. Those types of people. And so when you can hire nearly 400 professionals, all that you feel like you could hug at any moment, you create a pretty remarkable culture, a pretty remarkable environment, and some pretty remarkable services when you harness all of that and feed that through a delivery channel on behalf of, we were serving 31,000 people across those two markets. So that was a big one. I think another one was just being welcoming and being accessible. Like I mentioned briefly, we saw people in the health centers, but we also took care of them over the phone, through email, outside of the health centers. They could call 24/7 and talk to somebody from Harken Health regarding any of their concerns. And so we say we're here for you, we care about you, but only 8 to 5, Monday through Friday, and maybe on Saturday mornings. Other than that, you're on your own. That's not the right message. And there's so many of those types of messages in the industry today that actually work opposite, of some of the messages we'd love to, in the relationships we'd love to create. Another one was, hey, we really want you, to come to your annual health visit, but you're going to need to, pay for that. We're going to charge you for that. Although we really want you to come, it's going to cost you. And, you have to schedule it 3 months in advance because we don't have availability. So there's so many mixed messages in healthcare. So figuring out where those mixed messages are and doing what we can to eliminate those can be really, really beneficial.
Great, thank you for that. So then a little bit more of a question here. What thoughts do you have about how we could weave more empathetic practice into current healthcare delivery models, given some of the industry challenges, provider burnout, use of technology? What are some of the wins an organization could consider now?
Yeah, thanks. I think, a great start is we have a pretty good understanding what are the contributors to burnout today. And that's the first place to look. There's what are the things that are actually when we say burnout, we're saying eliminating the ability of our professionals to deliver empathetic care to our patients. So those are the things that are, the barriers, the direct opposite of what we're trying to accomplish. So usually, and every organization usually has a good understanding of what those things are. They've asked their professionals. You guys know that, documentation and use of IT systems and platforms by those frontline professionals is one of the biggest detractors. And some organizations have taken steps to address that. Like at Iora Health, that the use of health coaches to do most of that documentation and entry into the computer systems in a visit while physicians spend their time focused on their patients provides a very, very different type of experience. And the barrier to that isn't more costly, by the way. If you say, well, we can't afford to do that, we can't afford to have 2 people, in a bit. Yes, we can, because you make up for it with a better health outcome and a better delivery experience. But you also change the capacity of those physicians to also potentially see more patients. Actually, the clinic I go to recently, I had a recent annual evaluation, and they've switched to that model. And that's a small, local clinic where now my doctor, is in the room with another professional, and that doctor spent the entire time talking about me, focused on me, asking me questions, engaging with me. I felt completely different about that experience. So that's one area that organizations, I think, making a shift, acknowledging, that these are some of the barriers that are getting in the way today. And then I think the other one is, beyond maybe the scope of what we can control directly, but, just fee for service models, and just those propagate this manufacturing approach. Like, I'm seeing patients every 15 minutes, and I'm just going one to one to one to one to one all day long, every day. And that's really burning people out as well. So trying to get out of transactional, episodic type delivery of services and more into comprehensive relational, types of services is where we need to go. I get it, it's complicated and it requires a lot of different things, but there's a lot of pieces within all of that that each of us can probably make an impact on.
Great, thank you. You mentioned IT platforms as a countercurrent in your presentation. With COVID, there was many rapid virtual infrastructures that had to be set up to continue to deliver care, many of which that will likely stay even after this pandemic clears up. What are opportunities to add in empathetic care to the virtual environment when it's already existing?
Yeah, I agree with you. There's been remarkable innovation in the industry over the past few months, and I also agree with you in the hopes that a lot of that innovation will be sustainable and not revert back to, pre-pandemic types of experiences. I think, some of it will, some of it won't stick for a lot of reasons outside, any individual's direct control, whether it's policy changes or reimbursement models or whatever it might be, right? I think we need to understand that we need to keep the things that are also enhancing our ability to deliver on empathetic care and preserve those things as much as possible. I think we're looking at the into the digital, the telehealth world. I think it's serving a need without a doubt, but which needs it serves and how it serves those needs is definitely something we need to continue to design. I see telehealth services operating in a couple of different ways today. One is standalone. I can get, random nurse anytime I need for a quick question that's about an episodic short-term thing that it doesn't require any history to address it, and it certainly isn't going to require a lot of follow-up, right? But then there's other telehealth models that actually act as an extension of a relational model, maybe with your primary care physician, where, you start to use those for not urgent, not episodic events, but maybe check-ins on chronic conditions, or maybe annual, checkups and those types of things, right? That's where telehealth is actually enriching a relationship, and it's actually in a context of a historical relationship where some knowledge of your previous experience and your previous health status influences that moment in time and the conversations, the decisions you make, and then can actually be used as a platform for extension to follow up in relationships that are ongoing and continue to enrich the value of the experience that you're receiving. So I hope that's where we can get, telehealth to as well. Not necessarily that we need to stop doing it for the episodic things. I think that does serve a purpose, but it seems to me a lot of the attention has been on those models. That's the ones I see in the market, at least today. I hope the pandemic helps elevate the importance of the longer term relational uses of telehealth services, maybe with your primary care physician that you have today versus setting up another relationship with a nurse in another state somewhere that I don't know, and actually contributing to more fragmentation in healthcare.
Great, thank you, Ryan. And I don't see any other questions for our event today, so I believe that will conclude it here. Thank you, Ryan, for presenting to us at the Minnesota HIMSS chapter. Again, we will be recording this session and we'll be posting it for later viewing.
Great, thank you. Have a great weekend.